Hi, my name is Soha Khan, and today I want to share my research on how COVID-19 affected the care of women with breast cancer all around the world. I'll be focusing on three main things: screening, diagnosis, and results for patients. Before the pandemic, it was easier for women to get regular screenings like mammograms. These tests help doctors find breast cancer early, often before there are symptoms. Finding cancer early is very important because it gives patients a much better chance to survive. For example, if breast cancer is found when it is small and localized, about 99 out of 100 people survive for at least 5 years. So regular screenings really can save lives. During COVID-19, the number of screenings dropped a lot. Many hospitals had to pause routine services, and many women avoided going to clinics because they were afraid of getting infected by the COVID-19. Because of this, fewer women were screened, and more breast cancers were found at later stages. This shows how the pandemic made it harder for women to get the care they needed on time. Late-stage breast cancers are harder to treat. They often need strong treatments like chemotherapy or surgery. The pandemic also made existing problems worse. Women in low-income neighborhoods, rural areas, and places with fewer hospitals faced even bigger challenges in getting checked and getting follow-up care after screening. After these problems were seen, hospitals and clinics came up with new ways to help. Telemedicine or even online doctor visits made it easier for some women to get advice without leaving home. Mobile screening vans traveled to communities to reach more people. Hospitals also ran awareness campaigns to remind women to come back for checkups. Policies were changed to reduce delays in diagnosis and treatments. Studies show that because of delays in care, some breast cancers become more aggressive. Certain types of tumors, like those that don't respond well to hormone therapy, were seen more often after the pandemic. This shows again why for example, consider a woman named Maria. Before COVID-19, she went for her regular mammograms every year. But during the pandemic, her appointment was canceled and she was afraid to go to the clinic. Months later, she was diagnosed with breast cancer at a later stage than usual. Because of the delay, her treatment was more complicated and stressful. Stories like Maria show why keeping screenings available and safe is so important, even during a pandemic. This shows again why early screening is so important. The sooner cancer is found, the easier it is to treat. To sum up, COVID-19 made breast cancer care more difficult. Fewer screenings and delays in diagnosis caused more women to be diagnosed at later stages, and some tumors were more aggressive. The pandemic also made healthcare inequalities worse for certain groups. But there is hope. Telemedicine, mobile screenings, community programs, and policy changes are helping healthcare systems recover. Looking ahead, healthcare systems need to be ready for emergencies. By learning from the COVID-19 experience, we can make sure that the essential services like breast cancer screenings continue even during crisis. Thank you so much for watching and learning about this important issue with me.